Good afternoon, myself Lavi Mangla. I'll be talking about association between microbiological flora of conjunctiva, inferior nasal meatus and lacrimal sac in patients diagnosed with primary chronic dacryocystitis. As we all know, it is an inflammation of lacrimal sac and is caused frequently by nasolacrimal duct obstruction, major clinical syndromes being pain, redness, swelling and watering over the medial canthal area, which leads to thickening, accumulation of microbes and subsequent severe inflammation of lacrimal system. Therefore, it's a sort of a vicious cycle. And mostly polymicrobial infections are common, and regarding bacterial origin mainly, gram-positive organisms are most common, followed by gram-negative of both aerobic and anaerobic origin. So our objective was to evaluate the microbiological profile of these three connected anatomical sites, conjunctiva, inferior meatus and lacrimal sac, and to establish an association of these growth between these anatomical sites, and to also check for antibiotic susceptibility of the isolated strains. It was a cross-sectional study done at tertiary care. Sample size was of 30 patients, and the patient fulfilling the inclusion criteria were enrolled. Pre-operative assessment was done. Diagnosis was confirmed on syringing and probing, and statistics was done with a Fisher exact test. Pre-operatively, samples were collected from conjunctiva and the inferior nasal meatus 1 day prior to surgery without starting any prophylactic antimicrobial therapy. And sample 2 was collected from the lacrimal sac per operatively. The samples were immediately sent to laboratory and were inoculated on blood agar and McConkey, and samples were also sent for anaerobic growth. Among 30 cases, total of 90 samples, 30 from each site were sent for microbiological analysis, and the maximum were isolated from inferior meatus, accounting for a total of 28 isolates, followed by conjunctiva of 23, and in lacrimal sac 25. These were the growth. And the major gram-negative organisms were Klebsiella pneumoniae, others were E. coli, other Enterobacteriaceae species, Pseudomonas, Citrobacteria, and in gram-positive, major was of coagulase-negative Staphylococcus, followed by Staphylococcus aureus. And now regarding the concurrent bacterial growth of the major isolates that were found in our study, the concurrent growth between the conjunctiva and lacrimal sac, as we can see with bold black letters, the major association was found between Staph aureus and Pseudomonas aeruginosa in conjunctiva and lacrimal sac, while between inferior meatus and lacrimal sac, it was between Staphylococcus aureus and coagulase-negative Staph. Therefore, an association was significant only among Staph aureus in all the compartments, and CONS in inferior meatus and lacrimal sac, Pseudomonas in conjunctiva and lacrimal sac. And if consider the total isolates, significant association was found between conjunctiva and lacrimal sac, and not between inferior meatus and lacrimal sac, suggesting that it was the conjunctival microbial growth which mainly leads to lacrimal sac infection. And all the gram-positives were susceptible to vancomycin, linezolid, chloramphenicol, ciprofloxacin and erythromycin. Towards all antibiotics, susceptibility was good, while among gram-negatives, it was majorly 50% were resistant to ampicillin and augmentin, but susceptible to major antibiotics like piperacillin, tazobactam, and Pseudomonas was susceptible to meropenem, imipenem, and piperacillin. So as we all know, disorders of lacrimal system causes epiphora, punctal discharge, and medial canthal swelling. And it is a mucous membrane lined tract which is contiguous with two surfaces, and these are normally colonized with bacteria, leading to accumulation and obstruction. And there is a risk of soft tissue infection after open lacrimal injury without systemic antibiotic prophylaxis. Therefore, there is a role of prophylactic antibiotic therapy before the dacryocystitic surgery. So we conclude that organisms responsible for majority of the cases were CONS, Staph aureus, Klebsiella, Pseudomonas, and E. coli, and they may have a direct, the inferior meatus and conjunctiva, they may have a direct role in the pathogenesis of chronic dacryocystitis. Common antibiotics can be given, while vancomycin and linezolid can be reserved for severe resistant cases, and we have offered alternative sampling site for determining microbiological profile of patients with chronic dacryocystitis, and thus prophylactic antibiotic therapy to be given preoperatively.